Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today I'm joined by Dr. Macedo Rodrigues, and we're here today to talk about stroke.
A stroke is a blockage in the vessel that carries blood to the brain. It would be the equivalent of a heart attack when you have a blockage in the artery to the heart, but in this case it's to the brain. So it would be like a brain attack.
What are the most common symptoms?
So it can be many different symptoms, but the most common is like a paralysis of the face that you notice, for example, when you ask for a patient to smile and you see an asymmetry of the face. Other common symptoms are a weakness of the arm and a problem with the speech, which may range from like having difficulty articulating words or even not be able to talk.
What is a large vessel occlusion?
So a large vessel occlusion is a blockage in one of the main vessels that carries blood to the brain, as opposed to a small vessel when it's just a small area of the brain that is affected.
What is the treatment for large vessel occlusion?
So if the patient arrives at the hospital within a timely manner, they can receive the medication intravenous, which is called TPA, which is basically a clot buster, but also they may be candidate for an endovascular procedure, which is a form of minimally invasively remove the clot from the brain.
What is the window for treatment?
The window for the intravenous medication is up to 4.5 hours. Of course, the earlier the better. And for endovascular treatment, most patients will be up to 6 hours, but in selected cases, we can do up to 24 hours.
What is a thrombectomy?
A thrombectomy is a way to physically remove the clot from inside the blood vessel in the brain. So we go there and deploy a device that will capture that clot and remove it.
What are the chances for recovery after a successful thrombectomy?
If we do a mechanical thrombectomy, if the patient is eligible to that, the chance of being less disabled is much higher than if they don't have this procedure done.
What is the best method to get patients to UMass Memorial for EVT?
Once you suspect that the patient has a stroke, you should call 911. They will know where to take the patient because there should be like bring the patient to a hospital that is able to offer the intravenous medication. It might be UMass, but if you're far, you can go to another hospital and they will send the patient to us if the patient can have the endovascular treatment.
How does this technology help with a stroke?
The way we perform the procedure is with a very small incision in the groin, and using this equipment we can see our catheters navigating all the way from the groin to the brain based on the x-ray, and we can see where we are, and using contrast dye we can see the blood vessels, and that will guide us through the location of the blockage.